Hello, everybody. This is Gary. Um, Today is August 6, 2021, and this is just an update on my schizophrenia and my upcoming surgery on Monday. Um, there's not much to report on my schizophrenia. I haven't made a lot of videos in a very, very long time. I'm trying to get back into the practice of making more videos about my schizophrenia and my regular updates on my schizophrenia. Um, my medications have been reduced over the past several months. I was on 1,000 milligrams of Seroquel a night, which is quite a bit. It's actually above the norm of a max of 800, and even 800 is pretty high. 800 milligrams. I was on 1,000. One of the reasons we reduced the amount of Seroquel is because I have been having issues with urinary retention where I couldn't urinate at all, which is a medical emergency. I had to have a catheter placed into my bladder, draining urine into a urinary leg bag, which I've been wearing for the past 4 or 5 months. I had prostate surgery because the thinking was that my prostate was enlarged, which it definitely was, and that it was blocking my ability to urinate. So they removed part of my prostate to see if I could urinate again. And while I was able to urinate somewhat after that surgery, I was not able to completely empty my bladder, and it was still considered a medical emergency. So they reinserted the catheter. But getting back to the Seroquel, the reason they reduced the Seroquel is because they thought the Seroquel was causing my bladder to not be able to use the muscles around the bladder wall to let me urinate properly. I forget the technical terms for it, but there are several medications that can prevent the bladder from emptying out completely. And the thinking was the Seroquel at 1,000 milligrams was causing at least some of the problems with my bladder being unable to empty it completely. So we reduced the Seroquel from 1,000 milligrams to 600 milligrams nightly. We may reduce it further. We may even completely eliminate the Seroquel and replace it with something else. I'm back on Klonopin mainly to deal with the stress of wearing a catheter for the past 4 or 5 months, unable to urinate normally without it. I've been under a lot of stress lately, but I'm on a limited amount of Klonopin. I'm not allowed to take more than 1/2 a milligram of Klonopin a day. Anything more than that would be risk of getting me addicted to it and having to go through withdrawal symptoms later on. But me and my psychiatrist both agree that if I take 1/2 milligram max per day, it's not likely that I will become physically addicted to the Klonopin, although I suppose it's possible I might become psychologically dependent upon it, but that's something for a future time to worry about. So my schizophrenia has been pretty stable. Not much paranoia going on, not thinking that people are following me or anything like that. That's been a common theme in my schizophrenia. Paranoia, hearing voices, that's pretty constant. That hasn't changed. It intensifies sometimes. And I think the last time I went to the psychiatric emergency room was about 2 or 3 weeks ago. They didn't hold me. They evaluated me and let me go home. And I was the one who called the ambulance. And when you call an ambulance in Rochester, New York, for feeling suicidal, they automatically send the police first to clear the patient to get on the ambulance. So the person who is suicidal or potentially violent isn't carrying any weapons that might harm the ambulance personnel. But since I was the one who called, it was completely voluntary that I went, and they released me the same night from the emergency room. Um, Part of that reason for going was my voices were more intense than normal. I mean, my voices are always telling me that people are following me, but that's actually separate from the actual feeling of paranoia. Regardless of whether or not my voices are telling me people are following me, I could feel like people are following me, even if the voices aren't saying that people are following me. So the feeling of paranoia and the thoughts of paranoia can be completely separate from the voices that I'm hearing. Um, there haven't been much changes in my medication. Otherwise, I'm still taking Neurontin for anxiety, Protonics for my stomach problems, um, still taking my prostate medication, although that may not be necessary anymore because I had most of my prostate removed, and it might be redundant to be taking a prostate medication when most of my prostate was removed. Um, and I'm taking a few other medications for other medical problems, high blood pressure. That's fairly new. Um, I kept being told by ambulances, the emergency room, my other specialists that I had high blood pressure. So I went to my primary care nurse practitioner and we agreed that I did, in fact, have high blood pressure. And so we started me on a 2-dose high blood pressure medication once in the morning and once in the evening. I have quit smoking. I was smoking 2 packs a day. I quit almost 3 weeks ago. As of tomorrow on Saturday at 11:30 a.m., I will have not had a cigarette for 3 weeks. I went smoking from 2 packs a day to 0 packs a day from the moment I quit smoking. There was no gradual withdrawal. There was no slowdown. I figured that I am either going to be a smoker or a non-smoker. So I started using nicotine lozenges. And from the moment I first put that nicotine lozenge in my mouth, I not had a cigarette. Now, of course, I still have to face the issue of withdrawing from the nicotine. But for now, I'm just satisfied that I'm not smoking any cigarettes. Nicotine is a poison, but nicotine lozenges and nicotine gum are safer than smoking 2 packs of cigarettes a day. I did see a cardiologist a few weeks ago. We did a treadmill stress test with a ultrasound echo of my heart, and there doesn't seem to be any major damage to my heart from smoking. There's no major blockages. There's nothing structurally wrong with my heart. I do have some lung damage from smoking cigarettes. I have chronic bronchitis, but my oxygen saturation levels are pretty normal in my blood, around 95%, which is pretty good. Oxygen saturation is something to worry about if it drops below 90%. So I'm doing pretty good with that. And I wanted to quit smoking before I caused any more damage to my lungs as well as my heart, but more to my lungs because the damage to my lungs was becoming much more evident than any damage to my heart. Um, I was coughing and hacking all the time, constantly coughing up phlegm. My lungs always feel congested, or they used to. They haven't been for the past 3 weeks since I quit smoking. I still have cigarette cravings. I wish to fucking God I could go out and buy a pack of cigarettes and have a cigarette, but I'm more worried about emphysema and having to wear oxygen tanks for the rest of my life. So I've been able to stay away from cigarettes. Um, Statistically, people who have a psychosis, be it schizoaffective disorder, schizophrenia, bipolar disorder, 80% of those people smoke cigarettes, which is much higher than the general population. So it was not unusual for somebody like me to smoke endlessly and without limit. They've done scientific studies on schizophrenics. If you give them endless tobacco, they will smoke endlessly without limitation. Um, and I'm certainly proof of that. So, what's next? Well, I'm scheduled on August 9th for surgery on my bladder. I have what's called diverticuli in my bladder, which simply means that the outer walls of my bladder have ballooned out like water balloons in a couple of large spots and in a couple of smaller spots. Those larger spots are causing urine to be retained in my bladder. It makes it difficult, if not impossible, for my bladder to empty out any urine. And so the surgery is to remove those diverticuli, those water balloons. They did a CAT scan of my groin area to get a good look at my bladder, and there's definitely weakened spots on my bladder muscle wall that have ballooned outward like water balloons. And the goal of the surgery is to remove those water balloons, for lack of a better expression. I don't know how else to explain it in everyday terms. Diverticuli in the bladder just means that my bladder wall has weakened and has been stretched out like water balloons. The surgery's on August 9th, Monday, which is 2 days away. Today is Friday. It's 4:06 p.m. Eastern Standard Time in the United States in Rochester, New York. I will be going to surgery at 5:30 in the morning, Monday morning. Surgery will be robot assisted. It will take about 3 hours, and I will be spending at least one night in the hospital. Because of the nature of the surgery, it's more risky than my prostate surgery. When I had the prostate surgery, I was able to be discharged the same day, and I did not need to be admitted to the hospital. But this surgery is a little bit trickier, a little bit more complicated, and I will have to spend at least 24 hours in the hospital under observation after the surgery. Nobody's expecting any major complications, but with surgery, there's always risk of some kind, and I've signed the consent forms attesting to that fact. So I will be having surgery on Monday to correct my bladder problems. I will be wearing the urinary catheter in my bladder and the urinary leg bag for about 10 days after surgery to give my bladder time to heal. And then the goal is for me to see the nurse practitioner of urology on the 18th of August to remove the catheter. And what they will do is they will remove the catheter out of my bladder, out of my urethra, fill my bladder with fluid, and if I can urinate that fluid out again within a few minutes, that means I'm able to urinate and I don't need the catheter anymore, which is the whole point of the surgery. It was also the whole point of my prostate surgery, so I could urinate again. If this doesn't work, and there's a chance that it may not, and I still can't urinate, I will be sticking urinary catheters down my urethra, through the tip of my penis, into my bladder, 3 or 4 times a day to empty my bladder. It's called self-catheterization, and I will end up doing it for the rest of my life, which I don't want to do, and that's the reason I agreed to this surgery, so I don't have to self-catheterize. I'm hoping the surgery is successful, and after my bladder heals, I will be able to urinate normally without the need for self-catheterization or wearing a urinary catheter, a Foley catheter, and a leg bag for the urine. So that's all I really have to say for now. I'm pretty stable, I think, psychologically. I'm not looking forward to surgery. There's nothing fun about it. There's always confusion and worsening of my psychiatric symptoms after surgery. I've had surgery a couple of times before for a couple of different reasons. When I broke my wrist, when I've had hernia repairs in my groin and in my abdomen. Anesthesia always aggravates my confusion and my psychosis. The They prescribed painkillers when I had prostate surgery. I'm not sure that I would take those this time. They tend to confuse me because they are opiates. They don't give me a lot. They only give me 5 or 6 tablets for a couple of days worth. I'm not sure I would even bother to take them because they have a tendency to aggravate my psychiatric symptoms too. Opioids should be avoided if at all possible, especially if the pain isn't that severe. And actually, it wasn't that severe from my prostate surgery. Not enough to justify taking opioids. Um, I went to the psychiatric emergency room a few days after my prostate surgery, partly due to the trauma on my body from the surgery, the anesthesia, the opioid painkillers, trying to recover from the surgery, being physically and mentally isolated. Um, it all kind of snowballed and ended up putting me in the psychiatric emergency room. I don't want that to happen this time, um, which is less likely to happen anyways because I will be under observation for 24 hours in the hospital this time. Um, uh, so the surgery is going to be very early in the morning. My arrival time at Strong Memorial Hospital at the University of Rochester, New York is 5:30 a.m., which is fucking early, but I suppose that's a good thing because it means I'm one first in line for surgery that day, and the sooner we get the surgery over with, the better. I'm not looking forward to getting up at 5:30 in the morning for this shit. I have to get up and call a taxi to come pick me up. The buses simply don't run that early in the morning to get me to the hospital on time, so I'll be calling a taxi. Um, so that's all for now, I guess. Wish me luck if you see this video. Uh, I don't believe in God, so don't bother praying for me. I'm still a hardcore atheist. That hasn't changed, regardless of my schizophrenia or my surgery or my medical condition. I am an atheist. I will always be an atheist, and that's not going to change. So, share, like, subscribe, press the notification bell so you'll know when I put out new videos. And if you're wondering why I'm laying down when doing this, is because I'm fucking lazy. That's about it. Like, share, subscribe, press the notification bell.